Hi, so I'm going to be talking about shingles, also known as herpes zoster. Shingles is caused by the varicella zoster virus, which contains dsDNA in the polyhedral capsid, which is in pink right here. This capsid is surrounded by tegument, which is colored in dark green. This tegument contains viral enzymes that allow the virus to infect the host cell's metabolism and other functions, which allows the virus to be able to replicate within the host. Varicella zoster virus is part of the herpes viruses family. These viruses are known for their ability to establish a latent infection in their host, which means once the person has been infected with the infectious agent in the beginning, it will not completely go away. It will stay dormant in the person until it reactivates later in the future. Such as with varicella zoster virus, it's the virus for chickenpox, and once the person gets chickenpox, the virus lays dormant, and then it can reactivate to cause shingles. Symptoms of shingles include pain, burning, numbness, and tingling, which occurs 2 to 3 days before the rash appears in the area that the rash is going to appear. So it's typically on the left or right side of the torso. It can't be both, or the left or right side of the face. Once the rash does appear, people experience fever, sensitivity to touch, chills, fatigue, itching, and the telltale rash on one side of the body. When the blisters do form, they fill with a clear liquid, but once they start to heal, they become cloudy and then eventually scab over within 7 to 10 days. The rash is fully cleared up within 2 to 4 weeks. The shingles can be transferred through direct contact with the fluid from the blisters or through a vector such as bedding or clothing that the person was wearing. Shingles cannot cause shingles in a person that has never had chickenpox, because in order to contract shingles, you've already had chickenpox and have the virus dormant in your body, and then it reactivates. So a person with shingles would cause shingles only in a person that has had chickenpox. Shingles is only contagious during the blister phase, because the way it is transmitted is through the liquid from the blisters. So once the blisters are gone, there's no way for it to be transmitted. It is way less contagious than chickenpox because the blisters are able to be covered, and as long as people are washing their hands and not itching stuff and then touching other stuff, then they should be fine and it should not be transmitted. And as long as the person that is taking care of them makes sure they're doing proper safety measures to make sure they don't contract the disease. The high-risk patients include people that are ages 50 and older, patients with diseases such as HIV, AIDS, and cancer, people undergoing radiation or chemotherapy, and those that are taking medicine after an organ transplant. These people are at most risk because their bodies are not able to fight off the infection as well, because they're immunocompromised from different diseases such as cancer, immunocompromises. And then when you get older, your T cells that remember the virus decrease their memory of the virus, and then its ability to fight off the infection is decreased, and so it is easier for the person to get shingles. There are around 1 million cases of shingles in the U.S. every year and 34 million globally. It's more common in those that are ages 50 and older, but it can occur in children. It's an exponential increase as you get older, the increase of you getting shingles and PHN, which is a complication of shingles that I'll discuss later. Usually shingles only occurs one time, but it can occur 2 to 3 times in a person. Shingles is easily misdiagnosed before the rash appears because the pain is very similar to things such as appendicitis, pleurisy, or duodenal ulcer. Once the rash does develop, though, it is pretty easy for doctors to identify what the rash is, But if further confirmation is needed, then doctors can take a scraping of the blisters to be tested in the lab in order to confirm their diagnosis. There's no known treatment for shingles. Right now, there's only things available to weaken the symptoms and shorten the amount of time that you do have shingles, and decrease the chance of you getting PHN. There's antivirals such as acyclovir, valacyclovir, and famciclovir that are given to patients in order to decrease the symptoms, like I said. But they must be taken as soon as possible for them to have the most effect. Those that are taken later, those people have an increased chance of getting PHN. The itching can be relieved by wet compresses, calamine lotion, and colloidal oatmeal baths. The most common complication of shingles is postherpetic neuralgia. Symptoms include sensitivity to light touch, itching, and numbness, and the pain can last for 3 months or more, and it can last for years after the rash has disappeared. People often experience it, or say it's like one of the worst experiences they've ever experienced, and they say the pain can be burning, sharp and jabbing, or deep and aching, but it has been the worst pain of their life. It's caused by damaged nerve fibers that send inaccurate and exaggerated pain signals to the brain. So even like a touch of like a shirt on their chest where they had the rash would cause intense pain, and they wouldn't. So most people that have PHN do not leave the house because they can't put a shirt on because it hurts to put it on. There's no treatment available for PHN, but antidepressants are often given to these patients because their ability to not do any of their normal activities makes them very depressed, so antidepressants are necessary. And then topical anesthetics can be given to decrease the amount of pain, but there's no treatment to fully get rid of the PHN. Around 5% of people suffer from PHN, so it's not too common, but when it does happen, it's very horrible for those people. Other complications of shingles include vision loss, neurological problems, and skin infections. The vision loss and neurological problems often occur whenever the shingles rash is on the face, and the vision loss can occur if the rash is somewhere near the eye, which causes an infection in the eye, which ultimately results in vision loss. And the neurological problems can cause inflammation of the brain, facial paralysis, hearing and balance problems, and things like that. So the rash on the face is very dangerous because of those problems. And they can also still experience PHN on their face. So the face rash of shingles is the most dangerous type. On the body, there can be skin infections, as well as on the face there can be skin infections. But the body shingles rash is less severe, with their chance of complications that are more severe. The only way to fully prevent shingles is to vaccinate yourself. Washing hands and covering up the rash does help to prevent the spread of the rash, but the only way the spread of the disease, but the only way to prevent shingles fully is through vaccination. So there's 2 vaccines available, the Shingrix vaccine and the Zostavax vaccine. Shingrix was approved in 2017, and it is now recommended by the ACIP as the preferred vaccine. This vaccine is a recombinant zoster vaccine, and the DNA is injected directly into the host. It is recommended for those that are 50 years and older, and there's 2 doses for it, and these doses have to be around 2 to 6 months apart. It is 97% effective against shingles and 91% effective against PHN. Those that have taken Zostavax already can still have the shingles or Shingrix vaccine later on, but they would have to wait a few weeks in order to get the Shingrix vaccine. And there's no timeline for when's too late to get it, but you should get it when you hit 50 years old. The Zostavax vaccine was approved in 2006, and it was used until the Shingrix vaccine was approved in 2017. It is still used now, but only when people have an allergy or something like that to Shingrix, and they cannot have that vaccine. Zostavax is 51% effective against shingles and 67% effective against PHN. This requires only one dose, but since it is a live vaccine, immunocompromised individuals should not receive it because their immune systems might not be able to fight it off, and it could spur the reactivation of the varicella zoster virus.